This is Observer Radio. Your voice counts. Your questions are answered. This is Observer AM.
It is now 27 minutes after 8 o'clock in Antigua and Barbuda. Good grief, time has a way of flying on Observer AM. Anyway, the Antigua and Barbuda Bureau of Standards is celebrating World Metrology Day today, Thursday, the 20th of May 2021, under the theme Measurement for Health. Along with a recognition of the theme, we're going to have a discussion this morning to share with the public any important updates on the development capacities in metrology in the theme itself, and to relay updates from our friends at the Antigua Barbuda Bureau of Standards and their metrology program, which we've been following from time to time with our first guest, Mrs. Diane Lala Rodriguez. She's the director of the Antigua and Barbuda Bureau of Standards. And joining us on the line is Dr. Alfonso Jerry Simon. He's a specialist in addiction medicine and the vice chair of the Antigua and Barbuda Standards Council. I want to say good morning to you both.
Morning.
Good morning.
Good morning. Thanks so much for joining us, Dr. Simon. Now, first of all, Mrs. Rodriguez, what is World Metrology Day all about? Why is it significant?
Okay, so first of all, I will say metrology is the science of measurements.
Dr. Simon, I think you're driving a car and perhaps you're driving and not wearing your seatbelt, or there's a pinging in the background. I'm not sure what it is.
Okay, no problem. Let me rectify that right now.
All right. Thank you.
Okay.
Very well. You're not going to have, I can't bail you out if Constable Shillingford come to arrest you.
No problem.
Yes. All right. Mrs. Rodriguez.
Okay, so I was saying to you, first of all, metrology is the science of measurements, and it impacts our daily life. Mm-hmm. And the simplest one that we like to use is purchasing petrol for your car. So you want to know when you're going to buy the fuel that you're getting what you paid for. So if you paid for 2 liters, that you're getting 2 liters, and I specifically use liters because I'm one of those advocating for us to go metric for many years.
Mrs. Rodriguez, most of us still have our heads in gallons. How many gallons of gas did I get for, I don't know, $50?
Exactly. Yes. So you want to make sure. So we go out every year and we check these. You also want to know when you're traveling and your suitcase is weighed, that it's the correct weight. And so there are things that happen in the background, so we don't really think about it until it impacts our lives. Another very important one is the medical checkups that we do, the tests and so on. We want to know that the results are correct, because it is based on these results that Dr. Simon, for instance, would make a diagnosis and prescribe medication. World Metrology Day is celebrated on the 20th of May every year. This is in recognition of the signing of the Meter Convention on May 20th, 1875, and also in recognition of metrologists the world over and the work that they continue to do. Each year, discussions are held between the International Bureau of Weights and Measures and the Bureau of Legal Metrology to come up with a theme, and this year the theme is measurement for health, and hence the reason we have more engaged the medical community in helping us to promote this theme.
Okay. Dr. Simon, this theme, measurement for health, what does it mean to you from your perspective as a medical practitioner?
Well, the whole idea of metrology in health is very important to us as physicians and to our patients as well. Because if you look, for example, at diagnosis, and let's say, Darren, you go to the lab to do a test, God forbid, HIV or COVID, and they tell you you're positive or negative. No, that is what we call a qualitative analysis or qualitative result.
Right.
However, the analysis itself, the checking of in the analysis process is actually a quantitative process. So you're looking at the number of antibodies, viruses, or antigens for them to give you a result, positive or negative. So in terms of diagnostics, is very important. In terms of treatment, if I give you a medication, I want to know that, number one, that medication is efficacious or effective, but I also want to know it's safe at the dosage that I need to give you. So in that case as well, too, I have to have precise measurements of medication to know that I'm giving you safe, effective medication. And now even in the whole process of making other diagnostics, for example, blood pressure, temperature, your pulse rate, checking to see if the patient is stable or not, my instrumentations need to be very precise so then I can make proper decisions in the treatment and management of the patient.
Yeah, makes sense, because if you get it wrong, that could be a life or death issue.
Very much so.
All right. Now, with respect to this pandemic, Dr. Simon, and perhaps I'll invite Mrs. Rodriguez also to weigh in on this. How important is this focus of measurement in health? How important is it, or does it take on additional importance during this particular time, i.e. the COVID-19 pandemic?
It's very important, and it would have taken on additional importance as well. For example, when you look at, let's say, our safety equipment, or N95 masks, for example, the N95 mask is proposed to prevent 95% of certain pathogens from getting into your respiratory system. So I have to have the confidence that this mask is, the N95 certification in reality is really so. So I depend on Bureau of Standards, international standards, to protect me as a physician and as wearers of those masks. In terms of vaccination production, the vaccines have to be made to very precise dosage, be kept at very precise temperatures. So even when we look at the pandemic, all these processes of measurement take on additional importance for us at this point in time.
All right. Mrs. Rodriguez, your perspective on that question?
Well, the speed and severity with which the virus impacted us meant that new measurement requirements emerged. These were things like testing for the virus, and as Dr. Simon said, the performance of personal protective equipment. And he also mentioned measuring the efficacy of the vaccine doses. So we had to move quickly as a measurement community to put all these things in place. And this was aided by the fact that we've had very specific technical expertise in place all along. And it was a matter of, tailoring what we were doing to meet these needs. So we have built on what was there, but as was said by Dr. Simon, there are new requirements emerging, and that have emerged during the pandemic, and we've been able to meet these, I must say.
Right. Now, this begs the question, has the Ministry of Health, let's say, been perhaps engaged in a heightened level of consultation with the Bureau of Standards as it relates to the management of the pandemic?
Let me say we have been involved on the National Technical Working Group. I sit on the group with the others, so we are intimately involved with the Ministry of Health in this.
Fair enough. Coming back to you, Dr. Simon, I've been paying attention to the news. Well, of course I pay attention to the news. That's my occupational hazard. With respect to this variance, how does measurement have to do with the detection of variants, and they know COVID-19 variant B115 or whatever the case may be? What role does measurement play in that, is my question.
Well, of course, you're looking at detection of these, variants in a lab. So whereas it might be more of a qualitative biological test, you still have to do your measurements in terms of antibodies and antigens for you to say that, for example, this new variant is not responding to this vaccine, or this new variant is going to spread fast, or this new variant is going to affect you in a negative way, as opposed to maybe a variant that's not so so dangerous. So yes, we still have to also look at the quantitative analysis when we look at new variants, when we're looking at any measurement in biology.
Okay, understood. Now, there are some updates. Every time we have these engagements, Mrs. Rodriguez, you provide us with an update on what's happening in the world of metrology in terms of the quality assurance and quality infrastructure policies and programs for Antigua and Barbuda. What are the most recent developments that you think our listeners should be aware of?
Okay, so the whole issue of metrology is underpinned by the Metrology Act and the regulations that accompany this act. Just last year, we had a project where there's been some proposed revisions to that, and so we will be having discussions with Legal Affairs shortly to update the act. We also, under that project, were able to develop a national metrology policy as well. So that as well is going to guide our work. And we have a couple projects going where we are looking at the development of the temperature metrology lab. And so currently the persons working in that area are undergoing some training and mentoring. We are installing the equipment, and we are also making efforts to get a few additional pieces which will allow us to do most of the particularly body temperature measurements and to verify those thermometers to ensure that they are working.
You mean
correctly.
like the one that scans me when I come in the mornings? I put my hand up and it beeps and says...
We're trying to get there, yes.
Okay. All right. If you had a wish list, Dr. Simon, of areas where you would like to see improvement in the business of measurement, particularly against the backdrop of this pandemic, or just generally with respect to healthcare in Antigua and Barbuda, what would that wish list be?
I would just like to see doctors and, medical professionals be more aware that they need to calibrate their instruments, that they need to liaise and work with the Bureau of Standards to make sure that these things are done, the certification of your instruments, calibration, verification of your instruments. And not only medical professionals, but in any field of industry, even our builders, in terms of, measurements of concrete, for example, measurement of cement and all these other things that you use in building, or mechanics, So we need the gas stations, and the Bureau have done a good job in terms of the gas stations, certifying the gas pumps and things like that. So I just want people to be aware of whatever industry you're in that uses measurements, that you need to be working along with the Bureau of Standards so that we can, give our consumers or patients or customers, quality service based on our instrumentation.
Okay. Mrs. Rodriguez, tell us a little bit about the Metrology for Meteorology project in progress. And I smile as I because my word of the day was metrology, and I made sure I pointed out to the listeners, especially the younger ones, it's not quite directly related to meteorology, but yes, it is in many cases.
In many cases, yes, because a lot of the projections that are made would have been based on measurements. So the Metrology for Meteorology project, and the acronym for it is M4M, right?
Okay.
Is meant to provide awareness to regional and local meteorological services on all areas of metrology that we can provide to them, and also to develop, where possible, the required calibration services for the equipment and so on, and measuring devices that they may be using. It's also meant to foster a better working relationship between the National Metrology Institute and the National Meteorology Office. And so that has been going quite well, and we've had good cooperation so far, and we have some issues and activities on which we have agreed on and on which we are progressing.
Okay. What about that point that you didn't make the point, but in your response, you made the point, i.e. migrating to the metric system. How is that? I think every time we have an interview, I ask you about what progress has been made in that regard.
You see, the thing is, we've taken the process to a point where we are at a little hump in the road, which is what a lot of countries face, a big one, where a lot of countries got to, and that requires now a bit more resources, financial as well as some political intervention to say, okay, we now have to change. We're going to change as at this time, whether it be December 2023, December 25, we're going to change over fully. But then you have to assist persons who have measuring equipment to change that out. And so that is a cost that somebody has to bear. So we're using, for the most part, metric units in most of our agencies, because we have to communicate with the outside world, and they are using it.
Right.
But the little basic measurements, say, in the marketplace and so on, where the average person interacts, that is still being done in the imperial measures. But the metric system is a legal system for use in Antigua.
Yeah.
So we currently are using them both side by side. I hope that within a couple of years we will be able to change over, but...
Yeah, hope springs eternal. Dr. Simon, you're imperial practitioner or metric practitioner, or you interchange between the two?
Interchange between the two, because, of course, to work out some measurements, you use the metric system. For others, because of familiarity and for the ease of use. For example, if you tell a patient they weigh 100 kilograms as opposed to 212 or 220 pounds, I guess they will get the pounds a bit easier. They can work it in their head a bit easier. And if you're doing certain things with temperature measurement, for example, if we're plotting temperature graphs to check for what we call undulating fever, you find that in TB and in some other diseases. Sometimes it's easier to do it with the imperial scale, the Fahrenheit as opposed to the Celsius. But having said that, though, it's very important that we make our units clear when we're listing them. Because sometimes in medicine we tend to talk without giving units. I will say 20 epinephrine when I mean 20 milligrams, as opposed to saying 20 milligrams, I might just say 20. So it's very important for when we communicate in measurements to give our units. I know there have been several famous accidents in the world, or maybe not, maybe infamous, where you have equipment, even space equipment, being built in different countries.
Yeah, like
and in
the
one country that...
Like the Hubble
exactly.
mirror.
Yeah. So in one country, what you might be using an imperial measurement mainly, and another country using metric. Then try to put that thing together. Sometimes you have, things that are not very precise, and accidents do happen. So it's very important for us to be sticking to a system. I think we should be going to one system. I would prefer the metric, but make sure that when we get that system, that we are stating clearly what our units are.
Right, understood. Just to go back, the legislative framework is in place, right?
Yes.
The regulations are in place.
Just needing to be updated.
Okay. When you say needed to be updated,
this is part of the project last year where we had a review.
Okay.
So because this legislation dates back to 2007, there needs to be some updating to bring it in line with current.
Okay. Is that a work that's currently in progress?
Yes.
Okay. How soon do you think that might... Okay. Yeah, I have to remind my guests sometimes, this is radio. we can't see a shaking head. But your point is well taken. You're not sure.
Discussions have started.
Yes. All right. Now, as far as today is concerned, what do you want our listeners to take away from this discussion? After I heard Dr. Simon and Mrs. Rodriguez on Observer Radio, this was what I took away from the discussion as far as world metrology and why metrology is important in my life, my everyday life. I'll let Dr. Simon go first.
Well, it's just a case where we have to have confidence in the processes that are meant to protect us. So if, for example, I'm driving my ambulance to pick up my granny in English Harbor, I need to know if I go to the gas pump and say, hey, I need $20 gas, that $20 gas is going to take me to English Harbor and back so I can get to the hospital safely. So these kind of little things we need to think about, that metrology is very important. We don't see it, we don't hear about it, but behind the scenes, all these little things need to be calibrated to be certified so that you can be confident when you jump in your car, when you go to the doctor, when you buy something in the store that's supposed to weigh 20 pounds or 20 kilograms, that you get in the exact measurement that you're paying for. So those things are very important for us.
All right. How important is the relationship, before you answer the same question, Mrs. Rodriguez, how important is the relationship between the Antigua Barbuda Bureau of Standards and the international, what's the international organization called again? National Meteorological...
Bureau of International...
Right. How important is that relationship for us here in Antigua and Barbuda?
It's an important relationship for every country because everything is networked and linked back to the International Bureau of Weights and Measures, because that is where the primary realization of all the basic measurement quantities are realized and maintained. So let's take, for instance, the kilogram, the
it's still a
highest
piece of metal?
level. No. It's now that has been changed and it's now realized differently because the measurement community recognized that with time, although it's a very long time, that piece of metal was shifting, and since that is the highest level, how do you know that that is still correct?
True.
So 2 years ago, these things were changed. So we are all linked through a chain to that organization. And so that link then gives us the confidence in the measurements that we realize at the national level and that we maintain at the national level, and therefore we can pass that confidence on to the consumer.
Okay. And what about regional? Is there a regional body that also is part and parcel of this entire architecture?
Yes, this is the CARICOM Regional Organization for Standards and Quality, as well as we have our brother and sister national standards bodies across the region.
So you have your colleagues that you speak to from time to time, your WhatsApp groups and all that kind of thing.
And also the Inter-American Metrology System, SIM.
Okay. So metrology is big business.
It is big business. Big business.
All right. So the question that I put to Dr. Simon, I'm going to put to you now. What do you want our listeners to reflect on this World Metrology Day, Metrology for Health?
I want them to reflect on the importance of measurement in our daily life, to realize that it impacts everything in our daily life, to recognize the importance of accurate and precise measurements in the field of healthcare, and to advocate for the resources that the Bureau of Standards needs to carry out its activities as mandated by the National Metrology Act.
Well put. Dr. Simon, I didn't get to ask you, and I really meant to ask you, and I'm still going to ask you because I think I have another minute or two to go before we join Valerie Gonzalez-Barrero. But what I wanted to ask you, and you deal with addiction.
Yes, I do.
Right. Where does metrology fit into how you function and the service that you provide to your patients?
Well, it comes into play in many different ways. Because, as you know, quite often with substances that I will have to deal with, there's a medical legal issue. So if I, for example, tell the police that this person tested positive for marijuana, no, it has to be a certain level of marijuana that I tested in their urine or blood or, whatever measurement I'm using.
Got you.
So again, like I said, it might be a qualitative answer to say you're positive or not, but the process is always quantitative in terms of how many grams or milligrams of marijuana to whatever blood level or whatever blood unit. So these things are very important. Instrumentation has to be precise when I'm giving medication. So in many different ways in the healthcare system, in treatment, diagnostics, you have to be very precise with your measurement.
Yeah, understood. Listen, we could talk about this for the next half hour. I can't believe the time is evaporated. I just want to say thank you so much, Mrs. Dan Lala Rodriguez, the Director of the Antigua and Barbuda Bureau of Standards, and Dr. Alfonso Jerry Simon, Specialist in Addiction Medicine and Vice Chair of the Antigua and Barbuda Standards Council. We need to do these things more often, need to have these conversations more often. Dr. Simon, thank you so much. And Mrs.
Thanks very much, Darren. Thanks very much.
All the best to you.
Thank you very much for having us.
All the best. And happy World Metrology Day. All right. It's easier to say metrology than meteorology.
Well, it's easier to say meteorology as well, but it's when you're trying to say the two back to back. That's where the problem comes.
Happens to me all the time. In public view. Anyway, 9 minutes to 9 o'clock here, we'll have Valerie Gonzalez-Barrero right up.